Good afternoon, everyone. This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. We have them on most Monday afternoons at 1:15. Today, we are going to be talking about vaccine hesitancy with Dr. Catherine Brisland. She's Interim Vice President of Medical Affairs for Medicaid and Longer-Term Services with Optima Health. Good afternoon, Dr. Brisland. Thank you for joining us.
Good afternoon. Thank you for having me.
You know, there's been a lot of discussion out there about vaccine equity and about vaccine hesitancy. And you work with a group which is concerned for both. That is Medicaid recipients. Now, for those of us joining us who may not be familiar, Medicaid provides health coverage to millions of Americans, including low-income adults, children, pregnant women, elderly, and people with disabilities. So, Dr. Brisland, you've seen a lot of this hesitancy within that group. Anyone in particular there in that group? And tell me about that.
There's not really any group in particular. I think because of all of the news we have incoming at us, whether it's email or social media, there are a lot of rumors going around. And one of the reasons I wanted to come here today is to allay a lot of those fears. It's not isolated to just the Medicaid population, but our line of members that we're concentrated on, especially being in my position, are concentrated on getting the word out to the Medicaid members to get vaccinated.
Mm-hmm. And we know that among that group, though, we do have some people that we would call perhaps disadvantaged. We have the low economic group there that is provided care through Medicaid. Is it more difficult, do you find, with that group? Is it a matter of getting out the education, or is it a matter of actually getting them physically to a clinic that can help them, because sometimes they might not have transportation?
Actually, Optima provides transportation for all of those members desiring the vaccine, especially our Medicaid members. So if any of our members would like to obtain a vaccine, those we're reaching out to, we actually offer to arrange the transportation for them. So hopefully that's not an issue.
That's great. So let's talk about this hesitancy then. Do you think it's an issue of distrust in the safety concerns, or what is it exactly that is making folks so hesitant?
I think it's distrust. I think it's we're in a special time right now. This has never happened before, and fear of the unknown, and just a lack of knowledge and where to go for good information, reliable information about vaccine safety.
Mm-hmm. And so what would you, if you could talk to all of these folks out there who are hesitant, what are you saying to them? What is something that, or are you able to change their minds once you are able to talk to them?
Our care coordinators are doing a really great job reaching out to our members. And one of the things that they're doing is they're having a conversation about with our members about why they are hesitant about the vaccine. It could be one of a number of issues. Some members haven't been to their primary care physician yet to visit with them, for their primary care physician to actually say, go get the vaccine. A lot of members, from what I'm reading, if the physician hasn't actually told them to get the vaccine, they hesitate getting it until they find out from their primary care physician. Some of our members, interestingly enough, haven't gone to the VDH website or haven't gone to the CDC website. That may be secondary to them not having internet access, but we have made concerted efforts to send them mailers, to have town hall meetings in certain places in the state, and also to provide emails as well that provide information about vaccine safety.
So you said some of them haven't been to their doctors yet. They're kind of waiting for that prescription, if you will, to go get it. Other than that, what would you say, is there one or two main questions or areas of concern? Is it just they think that it was pushed through too quickly, or is it history? We know for a lot of the minority community, the Black community especially, it's a history thing that is keeping them kind of at bay for now.
I think it's a combination of both, and we have to continue as a health plan to reach out to those members and give them reassurance. There are multiple reasons, and you can't just nail down one reason why someone's being hesitant.
Okay. What is the number, would you say, among your Medicaid group? Is it half are not getting it, or is it more or less?
That's really hard to say.
Okay.
I can say that at this time, of our Medicaid members, we vaccinated approximately 14,000 of our Medicaid members already, or they have they've received the vaccine. Some members are getting it on their own. Some members are getting the vaccine directly because of our outreach.
Great. Now, we know that Medicaid does cover a lot of disabled folks. That's not to say they have an underlying disease that necessarily would prevent them from getting this, but are there underlying conditions where you're finding people are more hesitant, maybe autoimmune diseases, or people with certain diseases, chronic conditions, that are concerned that this might do more harm than good for them?
There actually is no pattern as far as are the immunocompromised more hesitant, are those patients with heart disease or those patients with diabetes. The hesitancy is seen really across the board and really across all age groups.
Is there any group that should stand back and wait, or is that up to a doctor conversation, your own personal doctor to decide? Is there any group that has a disease that should stay away from this, or just those with allergies?
Really just those on allergies, and the guidance that the VDH gives, the Virginia Department of Health, as well as the Centers for Disease Control gives, are the best guidelines to go to as far as who shouldn't receive the vaccine. And that's a very, very small population of members or patients.
In fact, I would assume maybe, and correct me if I'm wrong, it might be the opposite, that folks who have these underlying conditions should be the first in line. I know we got some data the other day from the Virginia Hospital and Healthcare Association, and most of the people who were hospitalized with COVID also had an underlying condition, as well as those who have died from COVID had an underlying condition like diabetes or hypertension or obesity.
Correct. So you are exactly right. Those are the people, and those were in the initial rollout, those were the first people that were eligible for the vaccine. And I want to say that even those individuals that had COVID-19 and were hospitalized, even they are encouraged to get the vaccine as long as they're at least 4 weeks out from their positive test or symptoms.
When the government decided last week to shelf the Johnson & Johnson vaccine out of an abundance of caution, what do you think that has done for those who are on the fence? And are you hearing about it from them?
We have not heard about that yet because the pause just happened last week. Right now, according to our care coordinators, they are having to reschedule some appointments, but not many. Depending on how long this pause lasts, will point toward how it affects our population and their hesitancy. I would like to point out that at least 6.8 million people were vaccinated with the Johnson & Johnson vaccine. And there were only 6 cases, and 6 cases, of course, is 1 case too many, that were pointed out as far as having a complication. So it is still considered safe, but the CDC is doing their due diligence, and the FDA, by having a pause and looking into this more closely.
Yeah, so it is literally 1 in a million for that.
Correct.
So tell me though, when you're talking to patients about this, we have lots of vaccines out there, and there are reactions that can happen with each of them. So how far out of the realm, or how not far out of the realm is this to have these kinds of issues?
It's not out of the realm, and we actually anticipated hesitancy on the part of our members or patients. It's natural, and we just have to continue to reassure all of our members that the vaccine is safe and effective, and will lead to us hopefully doing more things and getting out into the community and feeling safer.
Right, we have seen some groups now going out, and we know VDEM is spearheading one that has people actually going door to door in some communities now and setting up at grocery stores and shopping centers. What, if anything, is Optima doing specifically? You did mention mailers. Are you all doing anything else, phone calls, or will you be setting up specific clinics in neighborhoods to try to reach some of these folks?
Within Optima and Centera itself, Centera has set up specific clinics, and these are available on the Centera.com website or vaccinate.centera.com. Also, we are working with the Virginia Department of Health to have our members be aware of the various vaccination sites. The Virginia Department of Health has done an amazing job on vaccinate.virginia.com of being able to point and click, put in your zip code, and you can find out all of the areas where the vaccinations are available.
So I guess if you're sitting down with a patient, or I want to say the mom talk, but give me your best sales pitch. If you had me sitting in front of you and I was one of those hesitant people, what would you say to me to try to convince me to get the shot?
I would say to you that myself and all of my colleagues have received the vaccination, and all four of my children have received, three of my children have received the vaccination, and my 16-year-old daughter is signed up to receive the vaccination this week. It is safe, it is effective, it will protect you from COVID-19.
What about the fact, though, that I'm hearing, well, there's all these variants that are coming out, and I might have to get a booster shot again, and maybe I'm just going to wait till they figure this whole thing out, and I'm just going to wait till next year, or I don't get the flu shot every year. Why should I do this?
The COVID-19 vaccine, especially, has been found to be effective against these variants.
Oh, I'm sorry, you froze up a little bit, but I think that we got it. It's effective against the variants.
Yes. And the hesitancy comes from some of the media about some of the side effects. You may have a little bit of local soreness at the injection site. You may have a headache, a little bit of a fever, some body aches. These occur within 24 hours of the vaccine and disappear within 24 hours.
And so that would be much shorter, obviously, a little bit of discomfort for a day versus what could happen if you get COVID.
Exactly.
You did mention children, your 16-year-old getting the shot. I think that's one of the things that parents might be concerned about, is that there's one of them that is now tested on children, safe, I believe it's the Moderna, that children can get. So do I need to make sure that I specifically ask for that brand for Moderna, or can I let my, will they give my child a Pfizer? I might be nervous that my child's going to get one that's not safe for them.
Actually, just a little bit of clarification. It is actually the Pfizer vaccine that has been approved for 16 years and up, and the Moderna is approved for those that are 18 years and up.
Thank you.
So what actually happens when you go and register for the vaccine, they ask your age, and then that will determine if A, you're at the right site to receive the appropriate vaccine, or they will direct you to another site that actually has the Pfizer vaccine if you are signing up at a site that has the Moderna vaccine. But I think the way the website is set up, depending on your age, it will direct you to the site that will have the age-appropriate vaccine.
Okay. And as for the rest of us, I might be holding out. In the beginning, some people were holding out for Johnson & Johnson. They wanted the one and done. But now, is there any reason that I should be picky or specific about which shot I get?
There is no reason for you to be picky or about the shots that you get.
Everyone will do the same thing then, unless you're 16. All right. Dr. Brisland, thank you so much for your time today. We really appreciate it. And for those of you who are just joining us, I will have a recap of our conversation coming up today on WAVY News 10, beginning at 4. Again, Dr. Brisland, thank you so much for your time.
Oh, thank you for having me.
Have a great afternoon.